Not all fevers are malaria. The Nigerian Center for Disease Control says any febrile illness that has not responded to the use of antibiotics or anti-malaria should be regarded as Lassa fever. Good evening. Thanks for always staying with Lagos Television. You're watching Sound Health. I am Olasumbo Modupe. Today we are looking at the recurring cases of Lassa fever in Nigeria. The conversation begins after this break. Please stay tuned. Joining us via Zoom this evening is Dr. Japheth Olugbogi, Public Health Specialist, Founder and Executive Director of Japheth Olugbogi Foundation, and the Medical Officer of Health for Ifelodun Local Council Development Area. Good evening, Dr. Olugbogi, and thanks for joining us. Good evening, Dr. Olugbogi, and thanks for joining us.
Good evening, and thank you for having me on the show once again.
All right, Dr. Olugbogi, kindly bring us up to speed. Let's have the situation report of Lassa fever cases or outbreak in Nigeria.
Good evening once again, and thank you for having me on the show. Lassa fever, as we all know, is now endemic in Nigeria. What this means is that we now live with Lassa fever in Nigeria. Lassa fever is considered a disease that we live with in Nigeria. This is not unconnected to the fact that year in, year out, we have outbreaks of Lassa fever in so many parts of the country. If you recall, Lassa fever is worse during the dry seasons between November and April. But sometimes lately, it's been occurring during the wet seasons, rainy seasons as well. So as of week 11, which was the last and the second to the last and the last week of March, the number of cases we have in Nigeria were reducing. But up until then, I think we had up to 822 cases with so many people dead in Nigeria. So while you are in your corner of the country enjoying yourself, people are actually coming down with Lassa fever. People are actually dying of Lassa fever. So Lassa fever is endemic and is still ravaging in up to 23 states of the country as we speak right now.
Why do we keep having Lassa fever outbreak, and what causes this disease?
Yeah, thank you very much. It may be misleading to believe that we don't have it in all parts of Nigeria because there is something that is common with us in this country. Until we have discovered a disease or been able to pick up a disease, people usually attribute death or morbidity to some form of metaphysical power. But until scientists or doctors will come around and tell you, oh no, this particular death that your neighbor died all of a sudden or after a brief illness was actually particularly due to a particular disease. So it would be misleading to think that we don't have Lassa fever in other parts of the country. But what we can say is that it has been picked up. It is currently picked up. It is usually picked up in some parts of the country, while cases may not be reported in other parts of the country. That is not to say that they are not occurring in those parts of the country, because people treat fever, any form of fever at all. People would say they have malaria, and before you say Jack Robinson, they have started taking malaria medicine. You said earlier on in your introduction that any fever that has not abated after 48 hours, according to NCDC, should be treated as Lassa fever. So many people just treat fever without thinking that it may be something else. All they attribute it to is malaria, and typhoid. So there's so many people in different parts of the country that are having fever. If you have fever and you have used antibiotics and you have used anti-malaria and the fever is not subsiding, the physicians should start thinking of something else. And now, Lassa fever should be one of the diseases that the physician should start thinking about. So yes, we have it in 23 states of Nigeria, but we may just be having it in other parts of the country, but we are not detecting it, maybe because of poor health system or poor surveillance and what have you. But it does not mean that we do not have Lassa fever in some other parts of the country. Now, if you go back to those states where we have Lassa fever, our practices, our hygienic practices may be one of the reasons why we are having this, because Lassa fever is actually contracted through the feces and urine, or even consuming rats that are bush in nature, rats that are from the bush, rather, let me say. So when we have these rats coming into our homes, passing urine, or leaving fecal matter on our food substances, on our plates, on our utensils, and we consume them on gari. A lot of people open up gari and leave it to dry. Rats actually have a special affinity for gari. So they will play on this gari, defecate on it, pass urine on it, and all do all sorts of things on it. Even drinks, canned drinks, malt and what have you, soft drinks, they leave urine on it, and all suspecting human beings will come, drink this drink, consume these food items, and then apart from that, a lot of us leave waste very close to our homes. We leave waste in our homes. We leave bush around our premises. All these are practices that enable Lassa fever introduction into human beings and Lassa fever distribution in our community. I use the word introduction and distribution so that people would understand that when you make these practices, it is easy for people to contract Lassa fever, and it's also easy for people to infect other people with Lassa fever, because Lassa fever is a very highly infectious disease, and people can get it through sweat, urine, and fecal matter and blood of other human beings that may have contracted Lassa fever, consuming meat or consuming food items left unprotected, or even bushing also encourages rats to run from the bush into the homes. And you will agree with me that the peak of bush burning in Nigeria is a dry season, and that is one of the reasons why Lassa fever is commoner during the dry season in West Africa.
Apart from fever, what are the other symptoms of Lassa fever?
Lassa fever can also present with fever, cough, muscle aches, nausea, and vomiting. The individuals can feel unwell, and in a very bad scenario, they can start coughing blood or vomiting blood, and blood can start coming out from other parts of their body that you can think of. So it is not just fever that is a symptom of Lassa fever. We have body aches, cough, nausea, and vomiting. Those symptoms that are also common with some other diseases like malaria and COVID-19 and what have you are also symptoms that you can have with Lassa fever. You can also have the swelling of the face and neck as well. And this is a particularly symptom that is usually attached to Lassa fever.
Are there guidelines for the management of Lassa fever? Is this disease treatable?
Yes, unlike before, there are now guidelines for detecting Lassa fever in the community. There are now guidelines for detecting Lassa fever in the hospital. There are guidelines for detecting Lassa fever now, testing, and even picking up cases of Lassa fever. Now, for individuals in the community, once you have fever and the fever is not subsiding after taking antibiotics and anti-malaria, maybe after 48 hours or even 2 weeks, you have up to 2 weeks at least. When the fever is not abating, that is not going down, one should start suspecting Lassa fever. They shouldn't wait till 2 weeks even. You can visit a hospital, and the clinicians who are vast in all these symptoms can tell better when they talk to the person. They can realize when they talk and examine the person, they can realize that, okay, this particular thing you are having is no more malaria. But they have a high index of suspicion of suspecting Lassa fever, and then tests will be carried out. To test for Lassa fever, they will collect blood and carry out what we call polymerase chain reaction. Also, this test is not, you can't just do it in any lab, but in hospitals, they have contact numbers of disease surveillance and notification officers who will actually ensure that these tests are carried out at the appropriate laboratory. Now, for clinicians, we are urging them to have a high index of suspicion. Once you see a case of fever, do not treat every case of fever as malaria. Do not treat every case of fever as typhoid. Develop a high index of suspicion. Merge the presenting complaints with the history and physical examinations. And then if you have a history of eating anything that has to do that has been any food that's been left over maybe overnight or left without protection. Protection means that you didn't cover the food well, you didn't warm the food. It should be suspecting that this person may have eaten something contaminated by rats, fecal matter, or urine. So with this, we should be able to pick more cases of Lassa fever easily. And then let me emphasize that it is better picked on time. When we pick a case of Lassa fever on time, most of the clients usually do better. They usually respond to treatment faster than when the cases are picked quite later. You mentioned incubation period. The incubation period could be between 3 to 5 days, and it can also range between 3 to 20 days, depending on the immunity of the individual concerned. Then apart from that, the individual who has Lassa fever can develop complications if not treated on time. So it is noteworthy to emphasize that people who have fever, who is not reducing, who is not subsiding after taking certain medications, should ensure that they check into hospitals. And when they check into hospitals, our physicians, our clinicians should have a high index of suspicion to suspect Lassa fever and follow the appropriate protocols.
Dr. Olugbogi, tell us, what is our chances of survival if infected with Lassa fever?
Yes, the case fatality ratio, that is the number of people who die among the people who have Lassa fever, is about 20%. But it can increase up to 40%. That is to say that if you have 5 people who have Lassa fever, one of them can die. It also means that the number can increase from 1 to 2. So for every 5 people who have Lassa fever, 1 or 2 of them are at the risk of passing away if not well treated.
Are there complications for Lassa fever if infected?
I mentioned earlier on, one of the complications is confusion, seizures, hypotension, death, and all the rest. People who have Lassa fever, when it's bad, they can have what we call multiple organ failure. That is, most of the organs in the body begin to fail. And when this happens, you begin to see symptoms that are not even associated with Lassa fever, but symptoms that are associated with that individual system shutting down. So there are so many complications that come from Lassa fever, but seizures, confusion, hypotension, uh, multiple organ failure are top on the list.
Dr. Olugbogi, the first case was discovered in 1969. We are in 2023. Are there vaccines? Are there ongoing collaborations to check or end the Lassa fever outbreak in Nigeria?
I think to think of vaccine, we think of eradicating Lassa fever itself. For now, there is no known vaccine against Lassa fever. Um, I am sure there may be one or two in the pipeline, in the works. Clinicians, biomedical researchers are always working on these things. And the good news is that NCDC is also planning on, beginning to manufacture vaccines in Nigeria. But then again, we have to start thinking of other things we can do to prevent Lassa fever. These rats that I mentioned are very common in Nigeria. They are very common in West Africa. So they are not things or items or animals that can easily be gotten rid of. But then again, we should begin to plug the holes in our homes, holes that allow rats to come into our homes. We should begin to carry out more environmental hygiene to protect our food items, to protect our homes from rat infestation. A lot of people just dump waste and live with waste in some parts of this country, which is not hygienic. Apart from that, for those who care, you can start having a cat as a pet. Cats and rats, like the proverb says, a cat and rat fight. Cat and rat don't see eye to eye. So if you have a cat as a pet, you can actually ward off rats inadvertently. So apart from that, people should begin to keep their food stuff in covered plastics that can be covered and sealed to protect these food items being accessed by rats. And then we should also cook or boil or warm our food well before we eat them. We should not just leave food items open. And then hand washing is still very, very appropriate, and it's still very, very applicable. If we can wash our hands adequately and routinely, we will not only prevent Lassa fever, as I've said several times, we will prevent so many other communicable or infectious diseases from moving from one person to the other. Apart from that, in the hospitals, there's what we call IPC, infection prevention control. Every hospital should ensure they have adequate infection prevention control. And then we should also practice what they call injection safety. And individuals, health workers who treat any cases of infectious diseases should ensure they wear the appropriate personal protective equipment, be it face shield, face mask, goggles, even wearing the suit when they require to wear these items. This helps us from spreading these infectious diseases, not just Lassa fever, from one person to the other in the hospitals.
All right, Dr. Japheth Olugbogi, public health specialist, thank you so much for your time and expertise on sound health.
Thank you very much for having me once again.
Up next is Trending Health Report from around the world. Please stay tuned. It is still Sound Health on Lagos Television. We take a look at 2023 Autism Awareness Day theme. Well, this is where we say thank you on today's episode of Sound Health. Hygiene is key. Maintain high level. Stay with hand hygiene always. This will keep Lassa Fever and other diseases at bay. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.